Good evening and welcome to my final project presentation for Informatics 645 summer of 2019 with Dr. Bascaron. For this, for our final, we were tasked with assessing an incident that occurred with Dr. X in his attempt to see a patient, or his him seeing a patient at a skilled nursing facility that had been recently discharged from the hospital. There were several risk incidents that occurred. I would like to remind the team of the benefits of having a risk management program. Risk management helps to improve the compliance with accreditation and regulatory agencies such as the Joint Commission and the Centers for Medicare and Medicaid Services. Also helps identify system and provider limitations prior to an anniversary event. Decrease loss when you have a risk management team in place. They also aid with information gathering that can be used to help improve patient outcomes, and also help to decrease the number, type, and severity of adverse events that occur within a healthcare organization. With Dr. X's reported incident, there are 4 potential risks that we are decided to look further into. One was that he actually gained access into the secured a lockdown psych unit at the skilled nursing facility simply by showing a photo ID. This should not have occurred. There was some severe consequences if this had not been Dr. X and had been someone else. Someone could have had access to the patient in the skilled nurse in the lockdown psych unit and or their records. So both of those, the likelihood of occurring and the consequences rate high on the risk management assistant. The use of someone else's login and password to access the EHR. Once Dr. X did get into the system, did get into the unit, he did not have access to the system, so he relied on someone else to log in so that he could view the patient's chart and dictate his note. He dictated his note to an outsourced overseas transcription service that he uses for his personal, for his private practice. This had a medium likelihood of occurring and medium consequences. There's a potential breach of protected health information for the patient by going to an outsourced service. It was emailed. He received an email back saying that it was available and ready for him to sign. He then emailed it also to his office manager for her to upload into his system and to send a copy to the skilled nursing facility for them to add it to the patient's chart. Also the use of personal computers to access protected health information. Dr. X used his personal computer once he got home to access the report from the transcription service, and also his office manager uses the computer at his office as well. So the first risk we looked at is Dr. X's access to the lockdown psych unit. Our proposed solution for this would be to incorporate radio frequency ID badges and readers for access. With these, you can limit access to certain areas based on a person's badge. And that this would ensure that only the appropriate staff have access to the secure lockdown psych unit. It's imperative that the appropriate staff have access to this area, and that those that do not have access or are not trained to work in this area do not. We propose that it'll be about 2 to 6 months to complete. We can start with the lockdown psych unit and then expand throughout the facility. It will require some construction and system upgrades. My team will be on site to facilitate the go live on the training for the security team. The security team would be the gatekeeper for this project, so that once my team has been implemented and my team is no longer involved, the security team would be the one to grant access and to maintain the system. Also, with risk number 2, the use of someone else's login and password, immediately there should be a re-education for the staff so that they know that it is not appropriate to allow someone else to use your login or password, which is essentially your signature in the system. If someone was to have used their login or password maliciously, it would have fallen back on that person. And also understand that this is a severe violation of company policy, and it does have consequences up to and including termination for sharing your password and login. In Dr. X's case, we could implement a temporary access so that he could be able to see his patient's chart. And also we could work on having system interoperability with the hospital system so that they could cross over so that he could have access to both as opposed to just one, since he does see patients at both facilities. Here is down below you'll see the risk assessment for this type of implementation. For risk number 3, the outsourcing of an overseas transcription service. Solution here would be to locate a local service that will be able to integrate into the current EHR system. Less than $100,000, 2 to 6 months, less than 4 personnel to locate and implement. This will have a low impact as well. As far as the priority, everything is a 4 to a 6. This would be low on the implementation timeline from my perspective. It does have some urgency, but not as much as the first 2 risks that have been identified. Also, the use of personal computers and email. There's a risk here because most people on their personal computers do not have encryption services or firewalls built in to help mitigate having hackers get into their system. So the solution for here, we propose that we develop and use a double encryption service system for the remote login access. We can have a remote login portal that will allow for staff members to log in to be able to access the hospital system remotely, but it would be a double encryption, meaning they'll have to log in with their login and password, but then also have a temporary passcode that is either sent to them via text message on their phone or a personal email that has been set up by a third-party site, something like Duo Mobile, to help ensure that the system is not infringed. I propose that we work on the first 2 risks immediately, particularly the login and password, that re-education to the staff to let them know that they're not to share, and also having a system in place for access to the lockdown psych unit on the psych ward at the skilled nursing facility is important as well. I think that's where we should focus our time. Here are my references, and we are available to answer any questions that you may have. Thank you and have a good night.